Would you do that with any client? Like, could that be a question that you ask anyone?
You could, although because it's ultimately always an individualized plan based on the client's own functional history, not every client needs it.
Right.
Some clients, the evocative role of just walking into your office and, you know, the ritual of sitting in the waiting room, flipping for the, you know, 40th time through that Good Housekeeping issue from 1986, you know, going into your office, that's already got them primed, and they're already there. So it might be so you could ask anyone, but it's probably more meaningful with the client who tends to want to lead with chit chat for 15 minutes, or complain about the weather or the heat on the central line or whatever. So, you know, always coming back to like what's most evocative for this client in this moment. Let's see, and like any of the other process-based therapies, it really means that any evocative technique could be used if it's meaningful to a client. So the overall philosophy, technical eclecticism. Oh, I think I went off on a tangent, but the opposite of theoretical eclecticism in O'Donoghue, technical eclecticism, which says if you have a strong overarching theoretical framework, you can do anything so long as you can make sense of what's happening in the room. You could do artwork, you could play with sand trays, you could do whatever it is that you personally are drawn to. Boxing?
Boxing.
Excellent. Although, I don't know, what if you bruise a client? Like that could be, yeah, maybe, yeah, anyway, that's, I guess, like, if you've got the pads and things. Anyway.
What about like online therapy? Are there any activities that you recommend that are transferable to a digital medium?
Yeah, online is, well, I guess, like, because all those questions work, but what's something, like when you're online, it's sometimes fun to take advantage of the thing. You know, you can always drop a link in the chat box to a quick video, to a song. You could have, especially younger clients, though I have even older clients that love this, you know, sharing a YouTube link to a song they find particularly moving or that captures the thing they're having a hard time putting into words. That could be something that is easier and more natural to do via teletherapy than, I don't know, both pulling out your phones during a session, which could lead to a lot of other sorts of distraction. So,
I've got clients to stand up, to stretch, to show me parts of their house that potentially is evocative, to go to a corner and curl up and be a child, because that's the feeling I was evoking that moment. They can move around. They don't even need to see me on the screen. So it doesn't restrict you. You don't have to be in front of the screen. So
the pure purpose of it is to evoke.
Evoke, exactly. As long as I know I'm evoking, it doesn't matter. I'm not restricted.
Okay.
and you could also, it's great for observations about the function. I think of a client I've seen periodically through via teletherapy through the pandemic, whose own mother died at a relatively young age, and she also, while still a teenager, became caretaker for younger siblings, is quite successful now, still relatively young herself, and just had her first child. So when she talks about what being a mother evokes, or what it evokes about the relationship for with her memories of her own mother, how she relates it differently to her thoughts about decisions her mother made, just from a migrant family, so there was like sending siblings back and forth to live with family, or like waiting to migrate with. Having a baby in the room is really evocative. She'd probably have found a sitter if we were meeting in person, but the fact that that she's at home and it's teletherapy, and maybe it's maybe the baby requires attention. All of that lines up really evocative. really creating a more intensely evocative space. So, yeah.
What if it's the other ends of the spectrum? What if they're coming into the session so primed, so hyper aroused? Would you run with that? Would you just use it? Because I've got clients at the moment where it's really hard. Well, I'm finding it hard to work with them because they're so hyper aroused at that point. And it's just pure avoidant behaviour that I'm seeing in everything. I mean, is that just screaming TLB 1s and 2s to me? Is that what I should be picking up from it?
Yeah, it's, I mean, the function of a good wailing cry is often disconnection. You know, so you might, I think of clients where this has come up in session a lot, where you might try it to the extent you can, or if a person is composed at the start of the session, or sort of waiting to fully get settled into the session to engage in behaviors that are sort of too behaviorally loud to get around, then it's also a matter of trying to work quickly. How do you want to evoke a different tone? You know, I noticed last session we were unable to talk. It was so overwhelming. Can we start with a meditation right now? Can we start with this? So it's not, because evoking is not about evoking an aroused state as much as just evoking a connected affective state, a connected state that's authentic and vulnerable enough that we can find twos in it. So if it's one big one you're facing, can you shift at the beginning? That might be one place I'd try.
Okay.
Thank you. Any other thoughts?
I have a question, and
Yeah.
it's probably like comes back to sort of pull it back quite a bit, because it's so personal, right? And in terms of, and it's between the therapist and the client's relationship.
Yeah.
But based on who the therapist is, would really result in a lot of differences in that client, right? And so what you're thinking is just like, well, if me as a therapist or a coach, whatever, that I can only see whatever I see with my conditions, with my training or whatever kind of knowledge I have. But then how can we get to, I guess what I'm trying to say is that obviously we want to support and want to help the client to increase their therapy too, but if I don't see it, or because of whatever background that I come from, that I don't see that, CRP1, then I might lead them to a completely different path without even knowing it. Then I think like for me that would be like traumatized even, you know, like if say years back, later coming back to thinking about the client or something, I was like, oh my goodness, you know, like actually the CRP1 was this.
Yeah.
Then, I don't know, I'm not very clear about.
No, it makes sense. I do a lot of trainings in translation. I do a lot of consultation across borders. And sometimes you don't even know what it is, but there's that kind of like flavor in the air where you know that like, I think I'm missing something cultural, or I think that my own cultural understanding isn't working in this moment. And in those cases, the evocative and vulnerable thing on the therapist's part to do might be to say, I know how this would work for me and in my social setting. Walk me through how this works for you. Could you describe to me how people respond when you engage in this way? Is this how you want them to respond? Is this, and so while it's, you know, from a purely behavioral perspective, while it's suboptimal to rely on verbal report over what you can see and feel in a room, it can sometimes be a helpful adjunct to kind of see, you know, am I on or off base with what's happening here with this person? Because it will always, you know, will always look different. There's that same shared philosophy with sort of contextual behavior therapies where when I work with culturally diverse clients, I used to work with a large migrant and asylum-seeking population in San Francisco as well. When working with culturally diverse clients, when in doubt, I fall back and trying to look at, is the report I'm getting that this is workable? That the client's telling me that this different way they're behaving is working better for them in their day-to-day life or not? And letting that be a rule as well. We'll never completely know for sure. So, yeah.
Can I ask a question
Yeah.
on the back? What if the sort of the narrative that the client brings doesn't really match the consequence? The sort of they're saying, yeah, I'm trying all these things, but people are still responding this way.
Yeah.
And they may perhaps lacking the ability to really track their impact on people. How would you kind of actually bring that up?
I would increase the verbal tracking of impact between us. So one of the earliest kind of assessments of how therapy is going that Mavis writes a lot about, just back in '91 in the first FAP book, is just, it's always helpful to ask a client, how do you think I feel about you right now? How do you think I felt when you said that? Letting that be the assessment. So modeling that tracking, that attention. Taking the sort of interpersonally risky step of offering when there's a discrepancy. When what the client's telling you they think you're feeling or seeing or how you're responding is pretty far off from what's actually going on in you. I often find it helpful, I'll talk about this in probably the last block of today, I'm going to talk about tacting, but one of the sort of core functional units that our clients often can benefit from building up is just labeling what's going on in them, and which is very closely tied, in my view, to that tracking of behavior and behavioral responses. And so the first step is modeling, right? So the first step is whenever I give a response, I'm going to walk through as specifically as I can the specific felt sensation in my body, you know, what I feel on my face, what I feel in my chest, what I feel in my belly, the emotion labels I attach to that, the meaning I attach to that, and then I will ask for a reflection. So slowly shaping their own behavior with a mix of modeling, of reinforcing, of evoking again and again. Because clients who, I think it's often the case that our clients aren't tracking well. But we always want to bring it back to how can we practice that tracking. You know, your session with them is the gym session for tracking that week. So how do we keep coming back again and again to practicing that tracking? Thank you. Any other thoughts? When we think about the relationship of connecting and warmth in and outside of therapy, I think this is where it gets tricky and where it's very helpful to have colleagues or supervision teams you work with when you do this sort of work. Because when I mentioned earlier that functional analysis of what intimacy feels like, that doesn't change when we're working with a client versus meeting someone at a pub, right? So this is why, despite lawsuits and ethical rules and guidelines and things like that, the number one reason that therapists are brought before boards, at least in the U.S., is through having intimate relationships with their clients. This is it's a difficult thing to be so close and so vulnerable and to maintain that line. So there's not a clear one beyond the a priori rules and ethics that, and our values we're bringing to it. That being said, we can reinforce vulnerability without, with a limit of where we want to put it, right? Like you can reinforce vulnerability and intimacy and shape this behavior without even asking your client to tell you everything or every detail. We don't have to know every intimate detail of their life to do this work. And so sometimes monitoring the least amount that's workable is a helpful way to think about where we draw those lines. There's one of the places that I feel is very helpful from the compassion-focused therapy world is that Paul Gilbert and his colleagues have done a lot of work on the importance of recognizing fears of warmth. So clients who have complex trauma, who have histories of childhood abuse, often come to us with a sense that the more interpersonally vulnerable and warm we are, the more of a threat we begin to feel like. So it's important that you practice to be able to modulate your own warmth. And are always, this is why we have the Rule 4 on observing the impact we're having on our clients. Sometimes just a little bit is all that's needed, or is where we need to start before we start shaping to be comfortable in the setting of more warmth. And I think this also ties to work. Jonathan Cantor's done studies at the University of Washington Center for Social Connection, looking at the idea that when you explore and survey why people come to therapy to begin with, it doesn't matter if they've been diagnosed with a personality disorder, with something under a psychotic spectrum label. Excess of 60% of people say that they go to psychotherapy because they're lonely or because they've had a major rupture in a meaningful relationship in their life. It all comes back to, I think the major driver for most of our clients is connecting, and that's why they're coming. So our capacity to sit with that, to work with that, to reinforce that, is going to have an impact